Caucasian male. He presented with loss of vision in the right eye of 1 day duration, right-sided intermittent headaches of about 1 week with muscle aches. Patient was enjoying relatively good vision until a day before this presentation, when he noticed loss of vision in the right eye. This was sudden in onset, said to be painless, with progression over the course of a day and with no diurnal variation. Prior to this, he had transient visual obscuration lasting about 2 minutes a week earlier while having his dinner, with the second episode a day after the first, with normal vision afterwards. He noticed these repeated symptoms in the right eye only. There was no accompanying history of pain on eye movement or blurred vision after exertion. He only appreciates light shown to the eye when he occludes the left eye. There was no history of diplopia, polyopia, metamorphopsia, and no proptosis. Patient also had antecedent headaches, which he described as nagging right temple headaches that was intermittent in nature, throbbing, and severe in nature, and said to be relieved on ingestion of analgesic. There was associated history of right-sided pain also while combing his hair. However, no history of jaw pain or pain on mastication. Patient also noticed muscle aches, especially on the proximal parts of his limbs. He has been more fatigued recently than normal, with unintentional weight loss observed over the last 6 months. There was no history of morning joint stiffness or stiffness on exertion. There was no muscle contractures. He had poor appetite and feels unwell. However, no history of vomiting, change in bowel habits, or urinary habits. There was no history of redness, watering, pain, photophobia. There was no history of seeing halos, flashes, or floaters. There was no frequent history of change of glasses. Patient had no history of dysphagia, dysphonia, easy fatigability, and drooping of eyelids. There was no history of radiation therapy or chemotherapy in the past. He has not had any recent trauma to the eye and has not used any medication prior to onset of these current symptoms. Other history from the source I got could not be ascertained. On account of his condition, patient was said to report to his primary care doctor, and as part of his workup, an ESR was checked and found to be 116 millimeters per hour. His past ocular history revealed corneal aberration, which occurred 3 years ago in the right eye due to trauma. There was no history of past history of eye surgery, myopia, or glaucoma. Patient is a non-hypertensive but has been under good control and on medication. Um, he has also had hyperlipidemia in the past. Patient has had knee surgery a few years ago. His family and social history revealed no family history of glaucoma or any blinding condition. Um, Currently, they said he was a smoker and smoked about 1 pack per day for the last 40 years. Medications he was on prior to this presentation were hydrochlorothiazide, lisinopril, and simvastatin. There was no history of allergies in this patient. His review of system revealed mild chronic cough that is long-standing, but he denied any recent illness or any other heart, lung, GI, or skin symptoms. In summary, he is a 65-year-old Caucasian male who presented with a day history of sudden, painless loss of vision, preceded by 2 episodes of transient visual obscuration with associated right-sided headache and pain on combing his hair, proximal muscle aches, and unintentional weight loss. Thank you.
Okay. Dr. Abadu, that was very good. But I would like the house to comment and to ask questions if there's any. Thank you. Well done.
Thank you, sir.
Residents, please, can we hear your impression and your comment? There's a question for you, Dr. Agwadu. Okay.
Okay, sir.
It's just
Comments.
commendation. Just say well done. All right. Do you have any comment or question, please? Dr. Agwadu,
Yes, sir.
check your question and answer. There's a question for you.
Okay.
You read it out and then answer it.
Okay, he said, what question would I like to ask about the cough? So, considering the cough, I would like to first of all ask about the duration of this cough since when has it started having the cough to ascertain if it were um, an acute onset of cough or a chronic onset of cough. And I also want to inquire about other conditions such as drenching night sweats in this patient, um, and maybe swelling, back swelling, or um, history of persistent loss of weight, even though we've been told that he noticed reduced weight in the past 6 months. So by and large, I would like to dig more on the cough so that I'll see if there's any um, problems associated with the lungs that might predispose him to maybe developing um, uh, or throwing metastasis from the lungs from lung CA. Thank you.
Doc- Dr. Agwadu, I'm not satisfied with that. Hmm? Won't you
Okay.
ask whether it's a dry cough or productive?
Yes.
Whether there is
Yes.
associated chest pain? Is there hematemesis? Does he, or maybe hemoptysis? Whether he coughs with blood or whatever. Those are the questions you want to ask now. Of course, I agree. You need to know whether the weight loss has been ongoing for long or whatever. But it's a very good question, and you need to explore that symptom, fully.
Yes, sir.
Okay.
Yes, sir.
Yeah, there are more questions for you, please. So you
Okay.
can.
The next question said that please, what's the state of the left eye? Okay, sorry, I didn't mention it. There was no problems um, in the left eye. He attests to having normal vision in the left eye with no problem. Nice history. Just noticed you ruled out some ocular symptoms again, including photopsia after some systemic symptoms. Felt you should have come with the initial ocular symptoms you ruled out. Okay, thank you.
There is a question for you from Rosita.
Thank you, Dr. Rosita, for the comment. It's noted. Then on the hypertension, they say he has had good control of the hypertension over the years, which I captured it in the history. So maybe further examination will reveal more about the hypertension. Yes, he had transient. No, there was no history of transient loss of consciousness. The only thing he had was transient visual obscuration lasting 2 minutes per episode. He had about 2 episodes of it with the interval of 1 day between them.
Okay.
Yeah. He had a sudden loss of vision. He had an episode of transient loss of vision. Then the second episode. Then a week later, now had sudden loss of vision. But the way they described it, they said um, of 1 day, as in he monitored gradual deterioration, but to the point that he could only see light shone in the eyes, and that took about a day to get to that level. So I think I still feel feel within uh, the description of sudden. Thank you.
Okay. Please do you have comments from the consultants, please? Okay. If there are no,
Excuse me, sorry.
all right, all right. So,
For me, I would just like to just again emphasize when they say sudden loss of vision, you have to ascertain whether it's suddenly discovered or actually suddenly happened.
yes,
That's
ma'am.
all.
Thank you.
Okay.
Good morning, House. Thank you, Dr. Agadu, for the presentation. I have some question for you.
Okay.
What is the normal ESR? And then in what conditions can you have elevated ESR? The index case is a Caucasian. Can you entertain us on the causes of unintentional weight loss in Caucasian?
Okay. So,
Then your patient is on lisinopril and some other drugs. Can you let us know relevant side effects of the drugs the patient is currently using? Did you
yes,
specifically
sir.
tell us or rule out diabetes mellitus in this patient?
Rule out what, sir?
DM,
I hope
DM.
So I said rule out what?
uh, diabetes mellitus. Did you specifically ask that patient, or will you ask the patient? You try to rule it out during your clerking. Those are some of my questions for you.
Dr. Aguadu, can you react to the questions, please? Dr.
What,
Aguadu, are you still with us?
what is the normal value? Then there is what we call Western green, and then there is another method of, so you need to let us know. There's another method of measuring ESR. There's Western green method. There is another method. Maybe you'd let us know whether this one is Western green or the other method. Then what are the causes of elevated erythrocyte sedimentation rate? That's the. I hope you are jotting the question, Dr. Aguadu. Hello.
Dr. Aguadu, are you still there?
Maybe he's having issue with
Ah,
internet. I suspect he's having issue with the service provider.
Mm. Dr. Aguadu, are you with us?
It seems he has disconnected. Maybe he's trying to reconnect.
Okay.
Good morning, Dr. Ian.
Yes, Chief. Good morning, sir.
Morning. Please, can you give me a call and find out what is telling you?
Okay. All right, I will do that. Thank you. Thank you for the suggestion.